for anybody who's not it. So thank you for getting that recording going. And welcome everybody to our 2026 point in time training for new surveyors. So welcome all you new volunteers. We're really excited to have you here today and talk more about the point in time count. If you could take a moment and introduce yourself in the chat, who you are, what organization you're with, what balance of state region or county or town that you are a part of, and why you chose to volunteer, what you hope to gain from this experience. That'll help us with attendance purposes. So if you could please take a moment to introduce yourself in the chat, we'd really appreciate it. Today we will be going over a lot of material. Again, this is for our surveyors or people who will be, you all who will be doing surveys with folks in the moment on January 27th, which we'll talk a little bit more about. But if you have experience and have done the point in time survey before, we have a training tomorrow for those folks. So if that's you, you do not need to be in this longer training. You can join the meeting tomorrow. But if this is your first time participating in the point in time, we'd really appreciate you all being here or watching the recording. So we're going to go over what the point in time count is, why it's important. We're going to be talking about trauma-informed care and how that applies to our surveying, go over our regional approach to the point in time, actually go over the survey itself, talk about safety, privacy, confidentiality, and of course we will have time for questions at the end. So if you have questions, you can put them in the chat as we go through. Or you can hold them until the end and we will definitely have time to get to all of your questions today. But first, let's take a moment to introduce ourselves to you all. The folks here today are Colorado Balance of State staff. So I will be talking a little bit more about what the Balance of State is, but I'm Jerry Erickson. I am the director of the Balance of State COC. So I work at the Division of Housing, as does all lead agency staff. And I'm going to pass it to Natalie to introduce herself.
Hi, y'all. I am Natalie Kinniger. I am the Balance of State Continuum of Care team lead. I'll be presenting a little bit later today, and you likely received some reminder emails from me. So thanks, y'all, for being here. I'll pass it over to Crystal.
Hi, I'm Crystal Carr, and I am new to the Balance of State, and I am a specialist here. So it's great to be here with all of you.
You can see Carla is on our intro doc as well. She's not actually with us today, but wanted to make sure you all knew who she was because she is our HMIS or Homeless Management Information System team lead, and she is the primary contact for all HMIS data pulls and is really critical in our point in time data cleanup, housing inventory count. So you may hear from her as well. The point in time count is scheduled, like I mentioned, for Tuesday, January 27th of 2026. So that is coming up here in just under 2 weeks. So again, thank you all for being here today. This year's point in time count is a sheltered and an unsheltered count. So we're going to talk more about down the line about what that actually means, but just wanted to contextualize that a little bit for you all. HUD requires that we do this point in time count each year. And each year we have to do a sheltered count. And then every other year we need to do an unsheltered count. And that's historically how the Balance of State has operated. But this year, our governing board decided to continue to do both counts, even though we are not federally required to do the unsheltered count this year. And there's a few reasons behind that. One is we've been building momentum around our point in time count over the past few years and want to continue to keep people engaged, understanding the importance of the point in time. And we were the only COC within Colorado that was doing every other year for unsheltered. So the other 3 COCs were doing both sheltered and unsheltered every year, and we were only doing sheltered every year. So our COC was leaving out some statewide data that could be helpful for us going forward. So our governing board, again, decided to go forward with both this year. So we're going to be talking about and conducting a sheltered and unsheltered count for this year. But first, I'm going to zoom out a little bit. So we're going to talk about what a continuum of care or a COC is. I think a handful of you are newer to this work or to connecting with the Balanced Estates COC, so welcome, and wanted to make sure that everybody was sharing the same understanding of what a COC is. And in this field, we have so many acronyms, so I'd really try to define them before we use them, but if anything comes up that you do not know what I'm saying, throw that in the chat and we're happy to clarify. So a continuum of care, or a COC, is a collaborative. It really is a group of individuals and organizations from communities collaborating and really strategizing together about how to end homelessness. HUD, or the Department of Housing and Urban Development, requires this regional collaboration and requires COCs to exist and to coordinate together. And there's a handful of reasons for that. Really, I think at its foundation, it is so that we are improving our collaboration, coordination between local homeless service providers so that we are serving people better. We want to really reduce the trauma that homelessness is and not add to that as service providers. Additionally, we want to improve our homeless response system so that people are effectively moving through that system, getting connected to resources and housing, again, with the ultimate goal of ending homelessness. COCs really are also intended to expand community investment in preventing, responding, and ending homelessness. Again, engaging cross-sector community-based responses. So this is not just about homeless service providers, it's about all sorts of social services that an individual may encounter, really coordinating and trying to be a responsive system. It also, the COC model recognizes the importance of the local landscape. So even within Colorado, there's a lot of diversity in terms of our communities and what resources people have, how our cultures operate. And so COCs really provide us an opportunity to be adaptive based off of our local landscape. And it is the way and the function that communities apply for and receive HUD Continuum of Care funding. So COCs, again, are federally required, and there's a lot that goes into them. And really, the goal is to have a strong homeless response system, move people quickly out of homelessness, and prevent homelessness wherever possible, working towards that ultimate goal of ending homelessness. What is the Colorado Balanced Estate? There are, like I've mentioned, 4 continuums of care in Colorado. Metro Denver Homeless Initiative, or MDHI, is the 7-county Denver metro region. Pikes Peak is El Paso County, where Colorado Springs is. That is its own COC. And then northern Colorado is Larimer and Weld County. So essentially the Front Range is covered by those 3 COCs. And then the balance of state is all of the other counties, the 54 counties, essentially in a U shape around the Front Range, which is pictured here on this map. So this map details all of the 10 subregions. Again, talking about that diversity within Colorado, things do not look the same in our northeastern plains as they do in our southwest region, as they do in Grand Valley region, Pueblo. Like there's differences in all of those regions in a multitude of ways. And so our COC has broken out our 54 counties into 10 different regions to be adaptive to that. So when we asked you in the beginning to put your region in the chat, that's what we were talking about, if you were unfamiliar before. So just wanted to orient you a little bit to the balance of state. And as a continuum of care, we have many responsibilities, and one of them is completing that point in time count. Like I mentioned, this is a requirement from HUD that we make this effort to count everybody who's experiencing homelessness on a given night. But as you just saw, our geographic region is really large, covers many square miles, 54 counties, 10 regions. So we use a regional approach to tackle this really big project. And there are 3 primary groups for that. Our regional point in time coordinators, we're going to put that list in the chat here in a second, but those are the folks who are on the ground, who live in your communities, who are leading the charge, and will be actually coordinating the point in time counts the night of. We'll be deploying volunteers to various areas of your community and assigning you all jobs. So that's done at a local level. the surveyors and providers, so you all who are here in this meeting to volunteer to complete surveys, are the ones actually going out and doing surveys with folks, conducting the point in time count, and providing that information back to the regional coordinators. And then the Balance of State COC staff, so that includes Natalie, Crystal, Carla, myself, as well as some others who are just not a part of this meeting today, really help create the larger plan for our COC, support our coordinators, develop and publish training materials, and then we are the ones who are actually receiving, cleaning, and submitting that data to HUD and ensuring that we are meeting all of the HUD regulations and requirements of the point in time count. Those are kind of the distinct roles for the PIT. But let's talk a little bit more about what are we actually talking about here? What is the point in time count? And I'm gonna probably going forward just call it the PIT. Just know that that is the point in time. And it really is our attempt to count everybody who's experiencing homelessness on a single night in January. HUD does give us some flexibility to choose which day in the last 10 days of the month we can do the count, and our COC has selected again January 27th. And we are only counting people who are experiencing homelessness on that night. We are able to complete surveys in the days following, but again, we're always going back and asking, where are you staying the night of Tuesday, January 27th? So that gives us a little bit of additional time to actually collect that information from folks, which is really helpful. So the last day to survey will be Tuesday, February 3rd at 4 p.m. And this is a little bit different from years prior, so hopefully it doesn't affect you all who are new to this, but we can start counting people on the night of Tuesday, January 27th at 4 p.m., and then we're going a full 7 days to Tuesday, February 3rd at 4 p.m. We have a visual later that may help with that. Why do we do this? Again, because part of the reason is that we are federally required to, and the reason we are federally required to is because this information is often used by Congress when they are looking at how many people are experiencing homelessness. So it can really inform policy decisions at a congressional level. But additionally, at a local level, we really do use it to track and understand who's experiencing homelessness in our community, how that's looking kind of year over year, can help us measure progress and design policies. It really, especially through like events like this, helps us engage various community members in homelessness efforts, really help us. It's an opportunity to educate our community on homelessness and what it looks like in a particular region. It can help us identify strengths and gaps in our homeless response system. It's often used to advocate for those experiencing homelessness and apply for funding. And specifically, we do use it to apply for HUD's funds, but I know that some folks use it for other funding applications as well. In a little bit, we'll share what our data looked like last year. And it's always, if you ever need to use that information for applying for funding, you are more than welcome to. So again, these are the dates that I was just referencing. So January 27th, the night of the count. So we will be doing our sheltered and unsheltered count, as well as the housing inventory count. And then we have that period from January 7th through February 3rd to actually collect those surveys. So please take a note of that bar on the bottom that says PIT must start at 4 p.m. or later on the 27th and can go no later than 4 p.m. on the 3rd, because we have exactly 7 days to collect information. And again, I'm going to say this so many times today, but we are only asking people and surveying people for the night of the 27th. So if they were in housing on the 27th, they became homeless the next day and were experiencing homelessness the night of the 28th. If you're surveying them, they would not be counted for the purpose of the point in time survey. After that data collection period is over at 4 p.m. on February 3rd, we still have a handful of days for the coordinators to get the surveys to us. So we have until February 9th to actually input those surveys. Again, we'll talk a little bit more about that in a minute, but Just want to make that clear as well, that there's a little bit of additional time on the back end to submit those surveys. And I'm going to pass it to Crystal to talk about who we are counting.
Hi. So we basically count what we're going to consider two groups of people. People who are sheltered, that means that they're individuals or families who are usually participating in a program like a shelter or transitional housing, or they're with an agency that is helping to cover their hotel bill. Those are people that are all considered sheltered. Unsheltered people are those people who are living in places unfit for habitation. And that can be camping outside. Generally, it means we'll get into it a little bit more in the next one. So the good news about the sheltered counts is that our HMIS team is able to connect with those agencies and get those numbers directly from the agencies. And so it cuts out a little bit of human error, and it also helps when they go to deduplicate the unsheltered, the paper surveys and the rest of the surveys that are potentially unsheltered. So with the unsheltered pit counts, we're doing both sheltered and unsheltered this year. And we're using, HUD wants the literal unsheltered homelessness. So that means that it's people who are literally unsheltered, living outside, living in a place that's not safe for human habitation. Basically, I think of this as, is it physically safe? Are they legally allowed to be there? And is it consistent? Are kind of helpful ways to think about that. And then with that, so like generally if you come into a situation and maybe somebody tells you that they're staying with friends, people who are doubled up with families, they're not counted as homelessness, as unsheltered, or as homeless for HUD's literal definition. But if they're staying outside in a garage, someplace that doesn't have heat, running water, those places are typically going to be considered unsheltered. And then, so like if somebody's staying somewhere like in the hotel or in a hallway of a hotel or under a stairwell in an apartment complex, that too is going to be unsheltered because they're not legally able to be there. It puts them at risk and it's not necessarily consistent. And so those are kind of the ways that we look at who is unsheltered versus who is sheltered. So one of the struggles with the PIT data is that it's only for one night. It is essentially, as much as we want to talk about counting everyone who's experiencing homelessness, this is counting only people who are receiving services or that are visible, that are noticed and assumed to be homeless. It also uses the narrowest definition of homelessness, that literal homelessness. So it misses people who are couch surfing, doubled up due to economics, not the conventional definitions of homelessness we might have. And then we also know that, as Jerry said, this data is used to make policy decisions. It's important. And so while we know it's limited, we need to do the most accurate count that we possibly can to make sure that we are representing our communities accurately. Last year, Colorado created the first annual state of homelessness report that was great. And they go through and do a lot of explaining and provide nuance about homelessness. So I highly recommend that because they're able to pull from the whole HMIS system as well as Department of Human Services, SNAP, lots of different places with slightly different definitions of homelessness. And then, as Jerry mentioned before, this is the PIT dashboard where you can go and look up the number of people who are counted as homeless last year. And it's still pretty astounding especially when we look at this is kind of the minimum number. This is the base of people experiencing homelessness in our communities here in Colorado. And the dashboards are really cool because you can also slice it up in a lot of different ways. You can look at just your county, the whole state. It's full of great information. Are there any questions before I pass this over to Natalie?
Thanks, Crystal. There was a question in the chat that I want to lift up. Jacqueline asked, what if someone is staying in a shelter, but the shelter doesn't have any utilities? That's a great question. Typically, what HUD uses as meant for human habitation is there is heat and running water. So if a facility has heat and they have running water, they would be considered sheltered and not experiencing homelessness, unless they are staying at an emergency shelter, transitional housing facility, or a hotel that is paid for by someone else. So if it's a shelter, Jacqueline's exact question, they would be considered experiencing sheltered homelessness. If it's a shelter with no running water or no heat, they would be considered unsheltered because that facility is not meant for human habitation by HUD's definition. Does that make sense? That was a great question, Jacqueline, because it's very specific.
It would also be helpful for us as a team to know more about that situation, so we can, in general, like if there are specific nuances like that folks have questions about later, our email address will be at the end. We'll be sure I'll also plug it in the chat for folks, but if you all could send us an email with any of that information, we can problem solve individually as well.
Oh, thanks, Jerry. Okay. Any other questions about definitions before I get into data and data collection? Cool. Okay. I'm going to reiterate a lot of what already has been said through the data collection piece as well. So if questions come up for you, please put them in the chat. Feel free to interrupt me too. We've definitely got time for all the questions today. And again, like Jerry said, if you have specific agency questions that you want to dive into a little bit more, send us an email. One of us are happy to kind of hop on a call and walk you through anything. Okay, so how do we actually collect the data for the point in time count that we've been discussing? So Crystal mentioned this briefly. As much as possible, HUD encourages and we want to use HMIS. So HMIS is our Homeless Management Information System, which is a database that the state of Colorado uses. All 4 COCs use it to, excuse me, collect and store data on individuals experiencing homelessness for the purpose of connecting them to services. So if your organization uses HMIS, that is great. And we will be able to get PIT data from HMIS without having to do surveys. Not every organization uses HMIS. It's not always possible, which is totally okay. We've got survey options as well available for folks, and I'm going to walk through all of these in the next few slides. So, excuse me. First option here, like I was mentioning, HMIS data pool. So, our HMIS team can generate a provider's PIT data automatically. So if you have a shelter with all of your participants in HMIS, we can pull that data automatically, so you don't have to complete a survey with folks. We started this last year for the first year, and this year we're rolling it out with all providers. So if you use HMIS, hopefully you've already been connected to Carla and our broader HMIS team. If not, and you want to be, send us an email. But again, if you don't use HMIS and you're like, what is she talking about? That is okay. So the reason that this is preferred though, and why we really want to use HMIS as much as possible is because it is efficient. So it's faster for providers and coordinators. It's easier to deduplicate. So we don't get as many duplicated surveys, from the same individual. It's cost effective because there's less staff time needed to complete those surveys. And then also it's more trauma informed. So we're not having to ask participants questions that we already know the answers to, especially when they're personal and folks might not always want to share that information over and over again. Additionally, for HMIS, we can utilize this for unsheltered counts. So again, if you don't use HMIS, this is not a must. But if you use HMIS and you are completing an unsheltered count, so again, that means someone is sleeping in a place not meant for human habitation, like outside or in their car, in the hallway of an apartment building, etc. You see them on the night of the 27th, sleeping outside, experiencing unsheltered homelessness, and they are in HMIS, you can do a current living assessment update. So essentially, instead of completing an entire survey with that person, you can say, John Smith, you can go into HMIS and say, John Smith was sleeping outside on the night of the 27th, and that is it. HMIS staff will then pull that information directly, and hopefully it's a lot easier and more efficient. So that is how we are using HMIS when and where we can. Again, we know not everybody does that. And we also know this is new for a lot of folks and maybe are just not feeling comfortable utilizing HMIS, and that's okay. If you are interested, again, reach out and we can walk you through all of that. We've got tutorials on how to do all of those things. If you're not using HMIS, which may be many of you, and that's totally okay, the other option is to complete surveys. So survey options are definitely available. We are utilizing Survey123, which is the same platform we used last year, which I guess you guys would not know that because you're new, but that's okay. So same survey platform as last year, Survey123. The electronic survey is preferred here. And that is because we will not be accepting any paper surveys. And I'm going to walk through all of this step by step, but essentially, when we have previously accepted paper copies, it has created a big delay in our data because we have to do a lot of back and forth for handwriting discrepancies and all those kind of things. So we will not be accepting paper copies, only electronic copies. If you complete a paper copy, which is still acceptable, you will just have to enter that data yourself or work with your regional coordinator to get that done. So the electronic copy is preferred for both sheltered and unsheltered. The Survey123 app can be used offline. So you will have to download the app while you're on internet, while you're at the office or your home. But if you are out in the field in a place without service or just want to use it offline, that is 100% fine. You can do that completely offline on your phone, on a tablet, whatever it is. Again, you'll just have to download the app while you do have service. The survey link is available on our website, and I'm going to walk through all the questions up in the survey in just a minute, just so y'all know. But on our website, we've got the links to all the surveys, both paper and electronic, and we've also got training resources on how to use Survey123, which again, I'm going to walk through in this training, but they're available separately on our website too. So if you need to refer back to them, you've got easy access. One important tip we've got on here that I just want to call out is to have paper copies on hand as a backup. Just in case if you're using a phone or tablet or whatever, and it dies or breaks, those type of tech issues always love to happen in important situations. So we recommend that you have paper copies on hand as a backup, just in case that does happen. Okay, and then like I said, this is on our website, but just so that you all have easy access during this training to the surveys, if you scan that QR code, it will take you to the Survey 123 electronic survey. We've got a link here. And again, these are on our website, so don't feel like this is your only chance to grab them. And also, we will send these slides out afterwards, so you'll have easy access to this after this training. Okay, and the last option for collecting data is manual paper survey. So I've mentioned this a few times already. We ask that you use the electronic surveys as much as possible because we are not accepting those paper surveys, but we know sometimes people just have a really strong preference for paper surveys, or using the electronic survey is not always possible. So we've got the paper copies available in both English and Spanish on our website. And the primary changes compared to prior years, which you all may not even be aware of, but that's okay. They're very minor. So the surveys are very similar to previous years. We've made some formatting updates. So you'll see in just a minute, the paper copy is front and back. It's 2 pages so that we could get some larger text for folks to be able to read more easily. And then we also clarified some language that folks were confused about around agency and program information. Okay, I'm going to walk through the surveys in just a second. Are there any questions before I do that on the data collection options or anything I just discussed? Okay, so this is what the paper copy of the survey looks like. Jerry put the the link in the chat so you all can kind of pull this up yourself. But just wanted to show you what the survey looks like. Again, I'm going to walk through the questions step by step on the electronic version, but they are the exact same, the paper copy, on the app, on the web, however you use it, the questions are the same. This is what the front page looks like, and then this is what the back side looks like. So it's 2 pages, ideally printed front and back, and just kind of wanted to show you all what that looks like. Then again, I'm going to screen share this in just a second, but all surveys will need to be, there we go, entered electronically. I know I've said that 17 times now. This is the 2nd year that we're doing that, so it's still pretty fresh. So we just want to make sure folks are aware of that. And then we've got some links here, again, that are also on our website that walk you through everything I am about to cover. So if you're someone who needs to hear things multiple times, totally get that. Same here. We've got video tutorials to do all of that. But I am going to go ahead and screen share the survey and walk through that with you all. Make sure, okay, yeah, you can see that. Make it my full screen. There we go. Cool. So this is what will open up when you click on a link for the electronic survey. This is Survey 123. It gives you the option, and let me zoom in now before I forget, to open it up in your browser or in the app. I'm going to go through the browser because I'm on my computer, not on a phone or a tablet, but you will click the option that makes the most sense for you. Gives you a little notice here that if you don't have the app yet, download it first. Makes it much easier to open it up in the app if you actually have the app. But we'll open the survey in your browser and it will take you right to it. So we've got some basic intro information here. This survey should only be completed by providers in the balance of state who have not already opted into using HMIS. We're just trying to avoid duplication. And then we have one survey for sheltered and unsheltered. There's also a little note here to please not enter any test data once the point in time count starts. So as I go through this today, for example, I'm going to be entering test data. If you want to practice it with your staff, that's totally great. Just please don't do it starting on the 27th or after, because it makes our data cleanup a little more complicated. So first section here is asking for your information. So the reason that we need this is in case we have any issues with the survey. If we have questions about it or need to just follow up, we know who to follow up with. So it asks for your first initial, your last name, and then your email. Once you enter this once, if you're doing multiple surveys in a row, you won't have to enter it every single time. So trying to make that as easy as possible there for you. Okay. It asks for your agency. So what agency are you volunteering with? We have almost every agency, I feel like, in the balance of state listed. So you'll select your organization. If for some reason you're not listed though, you can select other, and then it'll pop up for you to type in your response. And then county of surveyed household. So what county are you completing this survey in? Where was the person who you were completing the survey with staying? What county? There was some confusion on this last year, so we clarified language because we're not looking for where your organization is located. We're asking where you completed this survey. I'll just click on a random county there. One thing to note is the web version is very specific because we want to make sure you're entering correct data. So for example, here for your staff first initial, if I put a space after my name, it's going to read that as 2 letters, and it's going to tell me I can't do that. Just to point that out because I know that's a little bit finicky, and it's helpful to know that before you are trying to do it and get really frustrated. Okay, consent to complete the survey. Very critical, arguably the most important part here is client choice. Asking them, may I ask you some questions for the point in time count survey? There's some helpful language here to explain to individuals why this is important, because that is very reasonable. They might want to know, well, why do you need to know this information? So there's some helpful sentence here. If they say yes, select yes, and it will take you to the full survey. If they say no, that's totally okay. Please respect that. Select no, and it will take you to an observational count, which I will also talk through. This is the same in our paper copies, by the way. So all these questions, all this language is the exact same. Okay, so assuming the person says yes, I will complete a survey with you. It's going to take us to that full survey questions. So where did you or where will you spend the night on Tuesday, January 27th? So again, we can start counting people at 4 p.m. or after on the 27th. You would ask, where will you sleep? After that, we have through February 3rd at 4 p.m. and you will still ask about the 27th. So where did you sleep on the night of January 27th? There's some helpful note here. If staying with family, friends, or a self-paid hotel, stop the survey, thank them for their time. They are not considered homeless by our definition. So if they are staying in emergency shelter, transitional housing, hotel or motel paid for by a nonprofit or government, if they are unsheltered. If you select shelter or transitional housing, it's going to pop up some questions about what shelter, essentially. So what is the agency that runs the shelter or transitional housing program? We'll select from this list. Hopefully we have them all listed, but for some reason, if we don't, there is again an option to select other and type it in. I'm just going to put test. And then there's an additional question about the name of the specific shelter. So, or transitional housing program. So these are specific programs like cold weather shelter, the Golden Girls Project in Grand Junction, for example. And again, hopefully we've got the program listed. If not, you can select other. Also, if you just don't know, there is an unknown option. I meant to select that there. Unknown, there we go. So there is an unknown option if you are not sure. Same questions pop up if you select transitional housing. If you select hotel or motel, it asks what agency paid for the hotel. So again, same options here as drop downs. Select the agency and program that paid for the hotel. And then for unsheltered, those questions do not pop up, obviously, because they're not relevant. So once you select where they were staying, there's some additional questions about their homelessness experience. So, is this the first time you have been homeless? Yes or no. Also, unknown or prefers not to answer. Totally valid. If they don't want to tell you, click unknown. How long have you currently been homeless? And these are ranges here. And again, unknown, completely valid answer. Some additional questions pop up based on what they ask. So unless you select unknown, unless you select 1 year or longer, it is asking for, including this time, how many separate times have you been homeless in the last 3 years? Less than 4 times, 4 or more times, or again, unknown. In total, how long did you experience homelessness in the last 3 years? Reason these pop up is to get more significant data and an understanding of people's homelessness. But if they've been experiencing homelessness for 1 year or longer, this information is not as relevant because they've been experiencing chronic homelessness consistently. So once you collect that information, you'll go to next. And then this is information about the client. So this is important to, again, explain why we need this information. This helps with that duplication, understanding who we're collecting data on and making sure that we're not collecting 5 surveys for the same individual. So we only need first 3 letters of their first name and then the first 3 letters of their last name. If they do not want to provide that to you, if they are very adamant against it, again, try to explain why it's important. If not, these questions are required and you can type in, 000 AAA, whatever it is, to make it accept your response. But again, try to explain why we need this information, but if they're not comfortable, move on. And then similarly for date of birth. So if they are willing to provide their full month, day, year, that's great. Type that in exactly. If not, see if they are comfortable to provide the month and the year. And the reason is that gives us an age range, which is really what we're looking for here, to understand what type, what demographic, what age group are experiencing homelessness in our communities. And that can inform program decisions in the future. So it can be helpful to explain that. So again, similar to above, if they only want to provide you with the month and the year, you can type in 00. If they only want to give you the year, also totally fine. If they're really adamant against it, type in all zeros. So again, trying to explain why we need this information, but again, not accepting that their response. If they do not want to provide that for you, move on. Okay. Next couple of questions is gender of the head of household, meaning if there's a family or group of people, the person who is representing them. These are not required. If they do not want to answer these, you don't have to. Same with race and ethnicity for head of household, and you can select all that apply here. And then the last couple of questions are required again. Are they a U.S. military veteran? Yes, no, or unknown. And then disabling conditions and barriers. Again, this is going to be a select all. If you do not want to answer these, you can select unknown, or obviously if they say no, you select no. But again, explaining that this helps inform our community need and give us a sense of what folks are experiencing in our communities. That's why it's important. Once you finish that, it's going to ask if there's a second family member. If so, you'll click yes, and then it will ask for the relationship to the head of household. So spouse or partner, child, parent, sibling, also other. Folks can define family how they want to define family, and that may mean friends, which is defined here. So if they are friends, but they tell you they are together as a household, type in friends as other. Once you do that, it's going to ask you the exact same questions I just went through, and you're going to do that for however many family members there are. So if there's a third, you'll click yes and do it again. On the paper copy, there is space for, I believe, 5 family members. And there's a note there that if you need to use an additional paper survey, if there's more than 5 people, that's totally fine. If there's not, if it's just a single individual, obviously you're going to click no, and then you are going to submit the data. If you need to submit additional ones, it gives you an easy link to go right back to the beginning. Okay. Questions on that? I know that was a lot of information and a lot of me talking. Any questions or things that people want me to better clarify about survey questions?
There was a question about transitional housing that I want to address because one of the options for where folks are staying is transitional housing. So I put the HUD definition in the chat for you all to reference, but transitional housing is temporary housing with supportive services for individuals and families who were experiencing homelessness, again, with that goal of stability and to move into permanent housing. Typically, participants in a transitional housing project must have some sort of occupancy agreement or signed lease with an organization that has at least a 1-month term and a maximum of 24 months. I think it is important to note here, too, that I think that's probably going to be one of our least surveyed options. And organizations know if they are a transitional housing program or not. So if you're a strict volunteer, you are not affiliated with an organization, just but you're going to be working with one to do surveys, just check with them and see what their definition of their program is. If you're out in the community, it's unlikely that you will run into somebody who is in a transitional housing program. So just a point of note there.
Laura put a great point in the chat, not a question, but I just want to lift it up because it's a great point of trying to count folks in the future that don't fit that HUD criteria. We know that the strict definition of homelessness does not include everyone that may actually be experiencing homelessness or at imminent risk. And that is something in the future we would hope to do. So thank you for bringing that up, Laura.
The question about if a parent and adult child share the same name or not in the same household, way to differentiate them, that's going to be done through their date of birth. And that's something that we do as a team on the back end. We do data cleaning so that if there are duplicates, we are removing them. And so that is a way that we would be able to tell that they are actually different individuals.
And that's also part of the reason why we ask for y'all's information as volunteers. If for some reason we're confused about that or just not totally sure if they're in the same household, we will just reach out and ask you and clarify. So that's part of the reason why we need that information. And then Bailey asked, what if the family is larger than 5? Yes. So there are instructions on the paper copy. On the electronic version, it will let you ask as many family members as you want. But on the paper copy, there's a limit of 5. And you will just use another paper copy and then staple them together. So that way you kind of make it clear that this is all one household of however many people, 6, 7, 8. And then
yeah, go ahead.
Sorry. If you have submitted a survey on an individual, can you bring it up again if you realize you've made a mistake? That's a good question. In the electronic version, no, you cannot bring it up. Depending on the mistake, and I think what I would recommend is excuse me, completing a corrected survey for that individual, and then just sending us a quick email to say, hey, I submitted 2 surveys for this individual. One is correct, one is not. Here's the mistake I made. Don't share people's personal information in an email, but you can share the first initial last name. Excuse me, oh geez. And we can help work to deduplicate that. If you did that without reaching out, like say you entered 2 surveys for the same person, one was correct, one is not, we would just reach out to you to confirm and say, hey, we've got 2 surveys for the same person. We noticed the data was different. Which one is correct? So we'll make sure that we get the correct information and deduplicate.
And then the last question that we did answer in the chat, Shanae asked about emergency warming shelters. If they're overnight, they're considered sheltered. I realized I didn't fully clarify that in my response. If there's just a day shelter that's open, but then people are not able to sleep there overnight, then it would not be considered sheltered. They would be unsheltered because they wouldn't be staying there overnight. But yeah, if it's not a year-round shelter, which is very common in the balance of state, if it's only opening when it's cold, that's still sheltered.
Cool.
As long as it has running water, I could imagine like a tent with a propane heater in it for emergencies would be
Correct.
still unsheltered.
Yep, I think relying on those definitions that we went over earlier is important. Thanks, Nathan.
Cool. Any other questions on the survey I just went over? Cool. I'm going to quickly go over the observational count. So when we talk about, oh, and here you see when you start over, all of your information is automatically entered, which is great. But when we ask for consent, if they say no, in the paper copies, it's the same thing. It gives you a little prompt and it says, if they say no, go to the second page. And that is an observational count. So you'll only use this section if you are not able to complete a full survey with a household. And this is exactly as it sounds. You are making observations from what you're able to see. So depending on where you're at, if you are at an emergency shelter, a transitional housing project, a hotel, or you see somebody sleeping outside, you'll select whichever place you observe them experiencing homelessness. It asks if they have any family members with them, yes or no. If you select yes, just estimate the total number of family members that you see together. And then it asks for the observed age group. You're going to try your best to say, I think this person's between the age of 25 and 34 or whatever it is. And then any additional family members that you are able to observe, you'll go through and do the same thing. And it asks, again, just continually for additional family members. And if there are no more, you'll click no. That is it for the observational count. It's very quick and easy. And then you will just submit that. And again, it's the same on the paper copy survey. That's pretty quick, but any questions on the observational count? Okay, cool. So let me move my screen back over. One other quick thing we want to show you all is the mobile app version. So if you have a phone, if you have a tablet, that is a really easy way to complete electronic surveys like I just went over in the field. However, if you do that, it is easiest to download the Survey 123 app and do it there. I'm actually going to play a quick video on how to do that because I am on a computer and not my phone. So I can't show you how to do that. But Carla, our HMIS manager, who is all of us together, she put a tutorial together for you all. This is available on our website, but we just wanted to show it to you all in the training so that you get all the information you need while we're here. So I'm going to go ahead and play this. Maybe make sure the volume is up. And
in this video, I'll go over how to use this.
Can you hear that okay?
Yeah.
Okay, perfect. Thank you.
Survey 123 mobile app on your mobile device for the balance of state point in time count. You'll start by pulling up the App Store on your mobile device. Right now I'm using an iPhone, so I've pulled up the App Store, searched for Survey 123. I found this page and I will click download. Once the app downloads, we'll open up the app. It might ask you to allow it to access the camera. This is not needed, so you can select Don't Allow. And now you can create an account and sign in, but you don't need to, so I'll just select Continue without signing in. It may ask you to let the app use your location. This is also not necessary, but you can select whatever you're comfortable with. I'll just select Allow while using app. And now we'll see the home screen of this mobile app, and you won't see the pit count survey here. And that's because we need to first open it up in a browser on our mobile device and load it into the app locally. So we'll pull up a browser on our mobile device, and we'll load the CoHMIS help desk page, which we've shared with everyone recently over email. This has all the pit count information and links that you need. We'll scroll down to the Survey 123 section, and we'll click on the survey link. We're then given the option to open in the browser or in the mobile app. We'll select the mobile app, and now we'll see it download into that mobile app. It'll automatically load the survey, but we'll exit out of this for now. And now you can see that that balance of state pit count survey is loaded into your mobile app locally. Keep in mind you do need to download that mobile app and load the survey into the app when you have internet access ahead of the pit count. Once you have done those two things, now you can conduct surveys without internet access. So I'll show a couple more things. So first, when you use the browser version, it'll automatically save the volunteer and county information on the first page, so that you don't have to complete it each time that you complete a new survey. For the mobile app, we can do this, but it just requires a couple extra steps. So what we'll do is before the pit count, we're going to collect a survey, and we're just going to complete the first page of information. So we'll complete the volunteer and county information. And again, this is just so that we can reach out to you if we have any questions about the surveys that you submitted. We will type in, or we'll select from the drop-down menu, the name of the agency that we're with, same with the county that we're conducting the survey in. And once that first page of information is complete, we're not going to continue on. We'll just click on the three horizontal lines in the top right-hand corner, and we'll select Set as Favorite Answers. Then we're going to X out of this survey and click Save in Drafts. You'll see a drafts folder now, and as long as that survey, that incomplete survey, is saved in your drafts folder, you can collect new surveys and paste in those favorite answers that we just entered. So we'll go collect a survey, and instead of typing in all that information, we'll just click on the three horizontal lines again, and we'll select Paste Answers from Favorite. So it's a couple extra steps compared to the browser version, but it is a nice thing that you can do on the mobile app so that you don't have to re-enter this information again. We'll continue on with the survey, and I'm not going to show you each of the survey questions since we already do that in another video, but I am going to go through a survey just to show you how to save this without internet access. So we'll complete a survey. We'll click that check mark, which indicates the survey's been completed. And if you have internet access, which you can see here, your device is online, which is the case for me, we can click Send Now. If we don't have internet access, we're going to select Save in Outbox. When we open up that Outbox folder, we'll see all the surveys that we collected and saved in that Outbox. When we have internet access later on, we can click Send in the bottom menu. It'll send in all those surveys that we collected. And then you'll see a sent folder, and you can see the surveys that you sent in. And that's how you use the mobile app for the electronic pit count survey. If you have any questions, please don't hesitate to reach out, and we'd be happy.
I cut off like a second short there. So that is how you use the mobile version. This is not required. If you're like, I am not going to do that, that is okay. We just want to make sure that you all are most prepared and best prepared that you can be if you would like to use the mobile app and if it is easiest for you. Can I see how to add the survey on the app again? Yes, I'm not going to actually play the video again. However, that is on our website. So I know we put our website in the chat already, and then I will also put the link to the training I just showed directly in the chat. So this is the mobile version. Sherry's already got it. What am I doing? Nice. So you can watch it yourself anytime. So that's available there. You can go back and see it as frequently as you would like. Okay. Before I move on from surveys, are there any additional questions about the web, the app, paper surveys, anything? Okay, great. One last quick thing before I turn it over to Jerry is incentives. So when we are completing surveys, we are asking people for their time and information. And so as much as possible, we want to provide them compensation for doing so. So every region and every organization has different incentives. And so connect with your regional coordinator to see what is available. These can be things like hygiene packs, tarps, hand warmers, whatever it is folks in your region need. Ideally, we are able to provide those to every person completing a survey. So as much as possible, we want to do that. And if someone denies the survey, but requests whatever the incentive is, provide it to them regardless, even like if they're not completing the survey. So just a quick reminder there on incentives. Okay, I am going to pass it over to Jerry to talk us through some trauma-informed care.
Thank you. So safety and really minimizing any impact that we have on the people that we are surveying is critically important to us. So we're going to talk about some guidelines there. We do have a script that we developed that we're going to pop in the chat here that is for you all to reference on how to talk about the point in time survey. So it starts with some safety precautions for yourself, and then it goes through some script guidance. So introducing yourself, asking if they've taken the survey yet. If not, it has a little paragraph about explaining what the survey is, and goes through that. It also has some tips about how to go through the survey. I'm not going to go over all of them. Please do take a moment to review them. Natalie has covered a lot of what is in there as well. And just want to point out that there is evidence that people experiencing homelessness are more likely to be a victim of a crime than to perpetrate violence on somebody else. So we want to come into engaging with folks who are experiencing literal homelessness with that understanding that they could have experienced violence before. They are more susceptible to violence in that moment. So we want to be mindful of that as we are entering into this situation. And safety is a top priority for you all as surveyors, but also for the participants who we are going to be surveying. So one thing that we and our coordinators are making sure is that people are always going on pairs. We're never going to send out one person to go find people and do surveys with them. Safety in numbers, we want to make sure that there are always at least two people going out and doing the surveys. As much as possible, we want to try to have some privacy when we're asking these questions. As Natalie went through and showed, we're asking people about their private medical history, as well as experience of homelessness. So we want to be private in that conversation. So not asking in front of a crowd, stepping aside, trying to get some space. Also, please discuss and follow any safety measures that either your particular agency or your region coordinator has. So they'll go over those with you, but just make sure that those are top of mind as well. And you're following that safety plan that your coordinator and point in time lead has developed. If you ever have a concern about safety, please bring that to your regional coordinator. Again, we are adaptive based on regions and the particular circumstance, so they're going to be best suited to be able to address any safety concern that you may have. Next, I want to talk a little bit about trauma-informed care and how this applies to the point in time survey. So for anybody who's not familiar, trauma-informed care in general is really seeking to create a physically, emotionally, spiritually safe environment to engage with somebody. Homelessness is a traumatic experience regardless. And often people experience other traumas alongside their homelessness, like we just mentioned, with potentially experiencing violence. And then also just like the exposure to the elements, exposure to other traumatic situations can put people on guard when they are living outside. So we want to create as safe of an environment as possible to do the survey with them. Trauma-informed care in general as like a principle is transparent and rooted in trust. So building and maintaining that trust is vital, which we realize can be really difficult in like such a short amount of time that you're going to be engaging with people. So practicing empathy, really listening to people and what they are sharing. Sometimes you'll find that people want to share more than what you're asking, and that's totally okay. Giving them that space to share their thoughts, feelings, their experiences is helpful in building that trust. So really bring that empathy, that listening ear when you're going out and talking to people. Trauma-informed care is also collaborative and requires consent from both parties. So we are working with people that we're surveying. We are not doing something to them. Again, at its core, trauma-informed care is intended to be empowering, building on people's strengths and those informed choices, and cannot hit that enough. Like, people are opting into doing the survey. We're not making anybody do anything. If they do not want to answer a question or do not want to answer the survey, Natalie went through those options of doing the observation count, and we're going to respect people's choices in that. And trauma-informed care is also rooted in humility, dignity, and respect. So please do your best to bring that to people, bring that to your engagement with people. I think the humility aspect of like, we are not experts of anybody's lived experience, they are. And so listening to that, being respectful of that is going to be critical. I want to take a minute to also talk about secondary trauma. If you're unfamiliar with that, that is the idea that you can experience trauma from hearing about others. So in engaging with the point in time count, there may be some difficult situations that you are witnessing. And if you yourself have experienced homelessness, have experienced a substance use disorder, domestic violence, mental health struggles, any other traumatic experience, this could bring something up for you. And if it does, that's okay. Please do take care of yourself, take a break or stop altogether. Talk with a trusted person, whether that's the person you're paired with or a coordinator. But don't just push yourself and power through. That can compound your own distress, and it could potentially harm the people that you're serving if you're not in a good headspace. So please be mindful of your own experience, what you are witnessing, and understand and know where your boundaries lie, and be okay to stop and step away. Please do communicate that with your coordinator so that they know where they need to maybe fill in some gaps, and also know about your status as well, and they may be able to offer you some support. Okay, so really going through and making that connection of the foundation of trauma-informed care to how it applies to surveying, again, rooted in dignity, respect, and consent. People have to have buy-in to this. If they do not want to participate, we are not making them do anything. As much as you can, bring a genuineness to this, a laid-back attitude, open mind, to put people at ease. We want to build that trusting relationship, again, even if it's just over a short period of time, and bringing your authentic self is going to help with that. It's okay to kind of acknowledge some of the strangeness of this. We don't need to be robots and read our script exactly, but really having a genuine conversation with people is going to be more important than that. Please be mindful when you are approaching people in their cars, if they're in tents, other structures, and remember that it is their space that you are entering. So please make sure you knock or announce yourself, ask if they are willing to talk to you, and being respectful of whatever that response is. We're never going to enter somebody's space without an invitation, and also don't enter someone's space if it's not something you're comfortable with. I would not recommend like going into somebody's tent, but maybe like sitting at the threshold, or sitting at the threshold to ask those questions, and really respecting their private space and boundaries, even if it is not a shelter. Our priority is the safety and well-being of you all as surveyors and the people who are being surveyed. So everybody's safety is equally important in this. I've said it before, I will continue to say it. Client choice is driving this. We are not pressuring anybody to do anything. We are respecting their autonomy and their choices around how they engage in the point in time survey. So if they deny that, the survey as a whole or specific questions, accept to the answer, submit what you can. Please do your best to not sneak up on anyone, especially in the evening, night hours. Identify yourself, who you are, why you're there, and ask for their consent to engage in the survey. And ask those questions without judgment. So like some of the questions people can assume will have a judgment associated with them, but do your best to not react to any responses that they have, and be calm throughout that process. And then like Natalie was just discussing with these incentives, provide an incentive and any other resources that folks might ask for or is helpful, regardless of if they're participating in the survey or not. So we're not using those incentives or resources to leverage over folks to get responses out of them. Even if they're not interested and you have incentives, please offer them, because you're going to be observing them, and therefore their information is still valuable to us, regardless of if they're answering questions for us or not. Before we go into our keeping our data safe as well, any questions or thoughts on our trauma-informed care section? Okay. Great, thank you.
Oh, okay. Before we open it for questions, want to touch on the importance of confidentiality and safeguarding information. So some of this we've already touched on, but just want to reiterate because it is really important. So it is critical that we respect and prioritize confidentiality and safeguarding individuals' information. Everything that folks share with you while collecting surveys should be kept confidential. Like Jerry was mentioning, sometimes folks might overshare and even give you more information than what you need for the survey. That is okay. And again, should really be kept confidential. Folks filling out the survey, they're not signing an ROI or a release of information, meaning they're not agreeing to say you can share this information. So any conversations during this time while you're completing a survey and discussing with folks should not be released or essentially shared with anyone. It needs to be kept confidential. And safeguarding, storing, and disposing of completed surveys. If you are completing paper copy surveys, please be sure they're kept secure with limited access. We don't want them left on like tables where there's in common areas or things like that. We want to make sure that they are secure and there's limited access to those surveys. They should be hand delivered to the coordinator, or if there's a designated individual that's entering your data, make sure that you are giving them directly to that person. If you are emailing them, like faxing them and emailing them to that person, make sure it's encrypted and tracked, meaning you're not including a bunch of other people on it, and it's just a direct handoff. And then keep these paper copies on file until it's been confirmed that they have been entered electronically. Once that's been confirmed, you should shred and discard these surveys. Electronic surveys, a little bit easier to keep confidential. They should not be printed offline, and then they should not be stored on the device. It would actually be pretty difficult for you to be able to do this. If you really wanted to, you could. So we just ask that you don't. But if you're like, oh my gosh, I don't want to accidentally do that, you won't. As long as you're just using the survey exactly like the tutorial shows. So that is how we are making sure that we're safeguarding and storing and disposing of completed surveys, both paper copies and electronic. Any questions about that? Cool. Okay. That is our training for y'all. So I know we answered questions throughout, but we've got about 10 minutes left if folks want to ask any additional questions about anything that we covered today.
I just want to verbalize, especially for anybody on the recording, one of these last questions that was answered in the chat. So the question was, if somebody asked to have a paper copy of the survey, can we give them a blank copy? And the answer is yes, but with the caveat that nobody should be filling out the survey for themselves. Only our trained surveyors should be actually filling it out. So if they want to just look at it for their reference to kind of see the questions and what's on there, by all means, go ahead and share that. But please never ask anybody to fill out a survey for themselves. I'm also going to put our general oops, I just copy and pasted it, so it says for situations like that, but our general email in here as well. If you have a question about a program or a more general question, by all means, send it to us. But you can also reach out to anybody on this slide. Yeah, Marco, go ahead.
Yeah, just kind of wondering an easy way to convey why someone is participating in the survey, kind of like what's in it for them or what result it can have from counting them.
Sure. The first thing that comes to mind for me is to help our state have a better understanding of who's experiencing homelessness so that we can, again, work to end it. And that can be through policy changes or funding opportunities. But I think the biggest thing is just really trying to understand what homelessness is looking like throughout Colorado to better advocate for people. But I'm curious what else people think is like a quick way to explain the value. Also, I think telling people up front, we have an incentive for you for your time, I think it can be helpful, even though that's not like the most motivating reason. Natalie, do you have any other thoughts?
This is a little bit more difficult if you're out in the field, but if you have like your phone or something on you, it can also be helpful to show the data from last year. So I just put that link in the chat and you can show, I'll actually pull it up really quick because I'm still screen sharing. You can show people, if you go to regional breakdowns, the counties, you can show them a little bit about like having this information be as accurate as possible helps us get more resources and make sure our region is well represented and that we are telling y'all's story with data. So that can be a helpful way. I know that's a little bit harder if you are doing paper copies, but if you're able to, that can be a helpful way to show folks visually what happens to the data.
There was a question about how to get incentives. So the incentives are going directly to the regional coordinators. So please look at the regional coordinator list, connect with your coordinator about how to physically get incentives from them. They have not received them yet. I'm hoping that they'll be ordered this week and therefore received by everybody next week. But your coordinators are going to be the best contact for that. Any other questions? Okay, I'm going to stop the recording.